Parents do their best to keep their kids strong and healthy, but dental health is something that is often overlooked.
Yeah, joining us now to share some dental health tips for kids is registered dental hygienist Whitney DeFogio, also known as the Teeth Talk Girl. Welcome back.
Thank you for having me.
I think so many parents overlook dental health in little kids because you're like, you're going to fall out. We'll wait till we get to the big ones, but it's really about establishing good habits, correct?
Yes, as well as what goes on with your baby teeth can affect your adult teeth later
Yeah, okay.
on.
Okay.
So I always remind my patients, of course, dental health it's important to have good smile, good cosmetics, but what goes on with your teeth can affect your quality of life, right? They can cause pain, they can cause gum disease, and gum disease, the bacteria associated with gum disease can actually increase your risk of heart disease, diabetes, kidney disease, Alzheimer's, a bunch of other conditions. So not taking care of kids' teeth early can set them up for all that stuff you don't want.
Yeah. So how early should we start our kids on a dental health journey?
So we really say when they're babies, before the first tooth erupts, you should get them used to healthy habits by using a damp washcloth or something in their mouth and wipe their gums. It gets them used to, kind of sets the stage for oral health, and it also helps them get used to you cleaning in their mouth. Once the first tooth erupts, that is when you want to start using a child-sized or an infant-sized toothbrush. You want to use a grain of rice-sized smear toothpaste on that toothbrush and brush it. Even if there's only one tooth, get in there and brush it. Once they start getting a little older, that's when it gets harder because now they either want to be independent and do it themselves or not do it at all, right? When they want to be independent, I always say that's fine. Let them brush. That's great that they want to brush on their own. However, not until age 7 or 8 do they actually have the dexterity to really effectively brush their teeth. So you should always be supervising brushing up until age 8, which is kind of later than I would have thought, right?
Yeah.
So, but yeah, always, if they want to brush, that's fine. Let them brush one time and then go in there and get the spots they missed.
Yeah, I was going to say, what is the biggest thing that they're missing as they're younger? The parents might not see that they're missing.
The most common areas that we see plaque buildup is the lower front teeth for adults and kids. So, like these lower front teeth, right where your tongue is, you have salivary glands there. There's a bunch of reasons. It's a hard area to maneuver with your toothbrush. So those lower front teeth, I always say, spend an extra 30 seconds on those. Okay. Little gentle circles. And the upper back teeth, your molars, where your cheek is. You kind of have to pull your cheek out of the way. Sometimes you don't want to open too wide because when you open wide, pulling your cheek, it's not as elastic. So don't have them open so wide, just a little, and then you could pull their cheek on, and it's more elastic, flexible to pull.
Okay.
All right. So my little one has already had 3 cavities, and I think it's more genetic, but okay, whatever.
Right.
So I'm sitting, why are we filling teeth that she's going to end up losing eventually anyway?
That's a great question. That's a big common misconception that baby teeth don't matter. They're going to fall out anyway. However, they really do matter because baby teeth, it's interesting, cavities on baby teeth, they spread at alarmingly fast rates. So if you have a cavity on a baby tooth, it spreads faster than a cavity on an adult tooth, and it can spread to the baby teeth all around it, which can, of course, lead to pain and things like that. And it can also lead to tooth infection. And if it's at the right developmental stage of the adult teeth underneath, those cavities infections can spread to the adult teeth underneath. So you want to make sure those baby teeth, healthy habits is a big deal as well, but also preventing anything bad from happening to the adult teeth below them.
Can we stay with this for a second?
Yeah.
So why not just pull the tooth?
Yes. So pulling the tooth, if it's too early on, there's going to be a space now. And so if you pull the tooth in between the two teeth, those teeth might start shifting. Now when the adult tooth wants to come up, there's nowhere for it to come up. So you have to have, it's a space maintainer in a sense, those teeth. So you really want the teeth not only to chew and talk and do all the things you need to do, but also to save room for the tooth underneath.
My oldest and soon my other two got their teeth sealed when they were little. Is that, it doesn't sound like it's real common because I know Tanya had not heard of that before.
See, yeah, some dental offices are like really, really pro sealants and some maybe aren't. There's different philosophies. However, everything we learn in dental school and dental hygiene school, I went to dental hygiene school, but we learn about prevention in dental hygiene school. And the prevention of, so sealants are when you place a sealant, basically, it's almost like the filling material that you put in, except you don't have to drill anything. The molars in the back are really groovy teeth. And those groovy teeth, things that kids eat like cereal and bread, sandwiches, that stuff gets stuck. So when that bacteria, it's a whole thing, and that's how cavities start. So if you can seal those groovy teeth so they're smooth, so food and debris, less likely to get stuck in there, that's a good idea. The reason some people maybe get nervous doing it is because you have to do them right.
Yeah.
If sealants, if there's any saliva or spit that when they're doing the sealant, when they're placing it, it has to be no saliva, very dry.
Okay.
And sometimes if it's a squirmy kid,
Yeah.
sometimes it's really hard to do it right. However, I'd rather try and seal it than not try.
Yeah. Oh, wow. And so you offer people help all the way around. You have a Better Mouth plan?
Yes, so Better Mouth, it's an interactive coaching program. It was created to stop dental problems from becoming a problem in the first place because most dental problems are preventable, right? And I know as a dental hygienist, of course, going to the dentist every 6 months is very important, but what you do in between those 6-month cleanings every day at home is just as, if not more important, right? And so I know a lot of patients, I'll be like, when's the last time you flossed or whatever? And they'll be like, oh, I was good at it for like 2 weeks after and then I fell off, right?
Yeah, yeah.
So that's where Better Mouth comes in. It helps remind you, hold you accountable. It's on your phone. It's an interactive coaching program with instructional how-to tutorials, nutritional lessons, everything you need to make oral care feel less like a chore and more like an act of self-care, right?
Ooh,
I love
that's
that.
a good way of
Yeah,
looking at
no
it.
kidding.
All
Thank you so
right.
much for being here. It's great to have you back.
Thank you for having me.
TeethTalkGirl.com is where you can get more information and sign up for your own dental coach. I love that.
I love it. All right, thanks, Whitney.